Hi everyone, my name is Selena Shepard and I will be presenting my presentation for the Section 4 video discussion post, Thinking about Safe Drug Consumption Facilities and Future Drug Policy. Starting off with the first slide, we are going to be talking about the pros of safe drug consumption facilities. First, let's dive into what exactly are safe drug consumption facilities. Safe drug consumption facilities are controlled environments where people can use pre-obtained drugs under the supervision of trained staff. These facilities are controversial, but have been implemented in several countries. Now, let's dive into the pros. Pro number 1, it reduces overdose deaths. Medical staff can intervene immediately in the event of an overdose, greatly reducing fatalities. Number 2, it decreases public drug use, shifts drug use from streets and public spaces into a monitored setting, improving community safety and cleanliness. Number 3, limits spread of infectious diseases. It provides a sterile equipment and safe injection practices, which helps prevent HIV, hepatitis C, and other infections. Number 4, it connects users to health and social services. It acts as a gateway to treatment, rehabilitation, housing assistance, and other services. Number 5, it reduces emergency medical costs. By preventing overdoses and disease transmission, these sites can reduce strain on emergency services and healthcare systems. Last but not least, number 6, it improves community safety. Fewer discarded needles in public areas and potentially less drug-related crime through better outreach. Now, moving on to the cons of safe drug consumption facilities. The first con is perceived promotion of drug use. Critics argue these facilities may normalize or encourage continued drug use, especially without mandatory treatment. Number 2, community pushback and stigma. Local residents or businesses may oppose the facilities due to fears of increased crime or declining property values. Number 3, legal and political challenges. In some jurisdictions, supervised drug use is illegal, leading to conflict between public health goals and drug enforcement laws. Number 4, limited reach. These facilities often serve a small fraction of the drug-using population, especially in rural or underserved areas. Number 5, cost concerns. Startup and operational costs can be high, and funding them may divert resources from prevention or recovery programs. Number 6, uncertain long-term impact. While short-term health and safety benefits are clear, the long-term effectiveness in reducing addiction rates is still debated. If I were a policymaker tasked with addressing drug abuse and addiction in the U.S., I'd take a comprehensive, public health-centered approach rooted in evidence. Drug addiction is a complex issue involving health, economics, housing, trauma, and more. Here's what my strategy would look like. Number 1, I would expand access to treatment and recovery. I would fully fund medication-assisted treatment programs like methadone, buprenorphine, and naltrexone across urban and rural areas. I would also remove barriers like insurance restrictions, waitlists, or abstinence-only recovery policies. Not only that, but I would also invest in recovery housing and peer support networks to reduce relapse rates. Number 2, I would decriminalize possession for personal use. I would decriminalize low-level drug possession. I would also redirect individuals to treatment, not jail, using diversion programs and drug courts. Number 3, I would strengthen harm reduction programs. I would fund needle exchanges naloxone distribution, fentanyl test strips, and education on safe use. I would also ensure all first responders and public spaces have easy access to naloxone. Number 4, address root causes, such as housing, mental health, and poverty. I would integrate mental health care and addiction services. I would also expand affordable housing and wraparound services for vulnerable populations. I would also increase funding for community mental health clinics and crisis intervention teams. Lastly, number 5, I would launch a national public education campaign. Similar to anti-smoking campaigns, focus on science-based, stigma-free messaging about addiction and recovery. I would also highlight success stories of recovery to inspire hope and humanize people who use drugs. That concludes my presentation over thinking about safe drug consumption facilities and future drug policy. Thank you so much for watching and listening. I also thought I would follow up by including this very inspirational quote. It says, "We cannot arrest our way out of addiction. Compassion, science, and community are the keys to real recovery." Thank you.